All right, you're staying home, you're washing your hands, but it's still allergy season. You might not be feeling great. So what are the symptoms of coronavirus that you need to watch out for? Dr. Vin Gupta joins me now. Dr. Gupta, thank you for joining us. What are the early symptoms of coronavirus?
You know, what's interesting is that the earliest symptoms is that you may not have any symptoms. The lag between infection and actually development of symptoms like cough, one of the most frequent symptoms that we're seeing in coronavirus, that's about 4 days. It's about a 4-day lag before you start seeing a cough, a productive cough. You might start coughing up just clear liquid. Sputum is what we call it in the medical world. You'll have a fever. That's a really common symptom as well. And then if things start to progress by about 7 days after that initial infection, you might start developing shortness of breath. And that's usually in our over 50 crowd or those with pre-existing lung disease or heart disease. That's what we're seeing has been the tipping point to go to the hospital for inpatient care.
So, doctor, you mentioned some people might have coronavirus but not be experiencing any symptoms. So that's why everybody should be staying home right now, right?
You know, here's the thing. Just because the person whom you might have contracted coronavirus from had mild or no symptoms doesn't mean you're not going to end up in the ICU. And that's very, very pertinent for the over 50 crowd that has pre-existing lung or heart disease especially. So regardless of who's transmitting the disease and how healthy they may or may not appear, it doesn't mean that that's going to be the same experience for another individual, and especially those who are older or with pre-existing disease, which is why you're having such a focus on social distancing. This is why you're having Mayor de Blasio, Governor Cuomo, and others really wrestle with, should we be doing these city lockdowns? Should we be doing national quarantines at the federal level? What should we be doing to compel people to stay at home? And so the best advice I can give as a pulmonologist is please stay at home. We know that the transmitters of this disease are maybe asymptomatic, and they may not know it because we don't have national testing. So that's why this is so important to distance yourself from others.
But what about people who are living with those who are high risk at home? What can they do to protect their loved one?
I think that's when you just have to practice good infection control measures that you would otherwise practice all the time. So good hand hygiene, if you're coughing, covering your cough. If you're having compelling symptoms for coronavirus, now that, again, just to emphasize it, cough, fever, if you've traveled to a region, that's also important, but that's an important consideration, but now anymore very relevant to whether or not you may or may not have the disease. If you have those features, then I think you should bring yourself to medical attention, because there's a lot of ways in which physicians, nurses, and other providers can give you help, can give you guidance, telemedicine, care chats via the phone. There's a lot of ways to get helpful advice and tips to see whether or not you actually need to come into a clinic for testing. We're spinning up drive-through testing all across the country, various health systems. There's lots of different ways to at least attempt to get some medical advice while we're building up testing. So
when should people seek treatment? You mentioned don't just show up at the ERs. There are ways, telemedicine, talk to your doctor, maybe over Skype, something like that. But at what point should you go to a facility?
It's a really tough question, so I would say first off, there's no immediate guideline here that says stay at home if you have this set of symptoms, go to the ER if you have another set. What I would say is, if you're over 50, if you have pre-existing lung or heart disease, if you're battling a chronic condition regardless of age, and you're feeling feverish, if you have a cough, at least bring yourself to attention. Call your doctor, call your provider, get some help. Make sure you're on somebody's radar. The point at which you want to go to the emergency room is the same point at which you'd always want to go to the emergency room, which is, are you feeling really acutely short of breath? Are your fevers really high? Are they not breaking? Are you just feeling generally unwell, feeling like you're going to faint? If there's an emergent type situation, an acute change in how you've been feeling, that's what should prompt you to say, something's wrong. And usually individuals are pretty good about determining what is an emergency level complaint, what's not. And really that's acuity of change in symptoms. So really bad fever, shortness of breath, that's just not getting better. I think that's what should prompt bringing yourself to attention in person.
Good information there. And we're expecting the virus to keep spreading. We're expecting increased testing to reveal more cases. So when we do see the number of cases go up, is there any way to tell if it's because of the spread or just because of better testing and information?
I think that what you're touching on is something I'm worried about. And it's something that I know my colleagues in public health and in epidemiology have been worrying about all along, which is what's the case fatality rate versus what's the infection fatality rate? And it's getting at that denominator. What is the denominator of actual total number of infected individuals in the country? We don't know. So it's hard to make a comment on the mortality or the severity of COVID-19 without knowing that. We're speculating, frankly. And so it's my sense that there's great articles that were actually just published yesterday in the journal Science by a group of epidemiologists at Columbia who showed that for every one confirmed case of COVID, there's probably 5 to 10 unconfirmed cases in the community. Wow. Meaning over 80% of cases potentially already exist that are not documented or diagnosed. And which is to say, is that reassuring that we're not having more people die because likely there's broad transmission and spread already? I don't know. Perhaps. I don't think that should cause us to feel like we're out of the weeds quite yet. And we have major issues in terms of lack of ventilators. I still think this has the ability to spread and really infect the wrong demographic, those who are older, who are vulnerable. So we have some work here to do, but you're right. I think testing might actually end up detecting what's already existing, what's the reality that already exists, and it's not going to tell us new information that's going to help anything because this reality already exists.
Dr. Vin Gupta, thanks so much for your time today.
Thank you.
About 7 million residents in the San Francisco Bay Area are in a state of shelter in place. And that means only places like grocery stores, pharmacies, and hospitals are open to the public. And even those have restrictions. NBC correspondent Jake Ward is with me from Oakland. Jake, you're home right now. Tell us about how the California government came to this decision, what it means for residents like yourself.
You know, Lindsay, this was a very interesting experience, right? As of midnight last night, you had a concerted effort among county health officials across at least 7 different counties here in the Bay Area, including San Francisco, Silicon Valley, Marin, and the East Bay, where I am, all coming together and saying, for the good of our citizens, we have to shut it down. And so they put in this stay-at-home order, this shelter-in-place order that essentially mandates that my family remain here unless we have some essential need, right? You cannot go out just to certainly not to meet with other people. We're allowed to go for walks. We're allowed to exercise outside to some extent, but the guidance there is sort of vague. But really, it's otherwise just trips to the hospital, trips to a pharmacy if you must, trips to a grocery store if you've run out of food. And so we are now sort of facing a new existence, right, where this is our lifeboat, and the 4 of us, me, my wife, and my 2 kids, are just hanging out here. And I don't know about you, Lindsay, but I'm not built for, running a sailboat, right, in the way that this is going to have to be for the next 3 weeks. All
right, you mentioned your kids are at home. What is homeschooling looking like for you?
So at the outset of this, my wife and I sat down together and we sort of said, we asked each other a question, what would you hope would be the result of 3 weeks together like this? And, obviously the first hope is that we all stay healthy. That's the point of staying home. Mine was very wishy-washy. I was basically like, I just hope we can all get along and maybe we can have some creative fun with the kids every so often. My wife, bless her, is so much more structured than I am. And she says, let's get them on a schedule. And why don't we stick as much as possible to the schedule that they had at school? And so right now we have a list that they help draw up each morning. And of course, we're in morning 2 here, so who knows if this is going to continue. But we're drawing up a schedule that says, snack, recess, literacy. We're going to do a little math. Then we do this. We've been starting each day with a bike ride. We don't, go and congregate with anybody, but we do go outside just to give them a little bit of a running around time. But it is very much this sort of test. I mean, my kids are basically saying, this is great, we're home from school. But I think we're going to get into week 2, week 3, and they're going to get a little sick of us. We're going to be a little sick of each other. Not to mention, will we be sick of eating pasta at that point, right? All of that stuff, I think, is where it's going to get rougher and rougher as this goes on for everybody.
Yeah, we're seeing and hearing a lot about grocery shopping. How is the supply where you are?
The supply is good. It's just that the staggering of the foot traffic is what slows everything down. This morning, I took a turn around my neighborhood just to see what was going on, and there was an incredible line out the door of our local grocery store simply because they were staggering it out so that only 10 people at a time were going in. So there was, about a 100-person line there. You can see that certain other essentials have disappeared. Chest freezers, for instance, the kind of freezer that you put into your garage, have disappeared from this region, right? There are people sort of stocking up on those sorts of things. But we're in the breadbasket of America. The fundamental supply of food here, as both the president and everybody else has been saying, is really healthy. We have all the food we need. It's just this feeling that you don't want to go out to get it on a, even weekly basis. You want to try and stay inside as much as you possibly can. So the pressure is on all of us to try to, stock up, make, fresh meals when we can, but try not to go out as much as possible. And that, of course, is the problem for everybody.
I feel like there has to be a pescatarian living in your house by seeing the stockpile. You've got beans better than bouillon and tuna fish. I'm just an observation.
We do. That's right. Canned proteins, right? That's what we're going for. The nice thing is, first of all, let me just say, right, we're among the luckiest people on earth, right? We have a nice house. We have a backyard. We have, we live in California where much of this food is grown. We're in good shape. But we also have, we're used to some natural disasters. So, out in the yard behind me, there is, in fact, a big chest filled with earthquake supplies and fire supplies. We had all the respirators already because you need that for fire season when smoke sweeps across the Bay Area. So we were out in front of some of this. But, as soon as you get into thinking about, what do we need to stay put and yet get the protein we need? Oh, right, beans. Oh, right, fish. We're going to need all of these things. It really does bring you face to face with, what we had all been taking for granted, the opportunity to just, walk down to the local store, pick up what you need and come back. I can't imagine what it's going to be like for people who live in a one-room apartment or, God forbid, don't have a place to live. How they are going to deal under these circumstances, I have no idea. We here are very lucky.
Well, we know that we're all supposed to be keeping our social distance right now, but there's some stories on social media, people helping their neighbors, things like that. Are you seeing that in your neighborhood?
In my neighborhood, we have a good coordinated effort going on where we are all in touch with one another by text. But if we do need to exchange items, we're doing it not by social contact. My wife had a very funny conversation with our neighbor just the other day where she only would look through the sort of the portal of the door and wouldn't open it, which is good. That's the right thing to do. All of this stuff feels awkward, right, Lindsay? It feels socially awkward to be wearing a mask when someone says, I can't understand you, you want to take it off, and then you realize, oh no, don't take the mask off. Right? These things are going to be the sort of new normal. In this case, I think we're determining that neighbors, right, polite neighbors, leave goods for each other at the door. You don't hand them over, right? These kinds of things are the sort of the precautions we are taking. But it really is going to be this test of the sort of social fabric. Fortunately, here in our neighborhood, the social fabric seems pretty good.
And it's not personal. People are just looking through the peephole. Thanks so much, Jake.
That's right. Thank you.
Hey, NBC News fans, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.